Hello, everyone. Thank you so much for joining us. We're going to give folks just a minute or two to just join our meeting. So please feel free to introduce yourself in the chat box if you'd like. So name, preferred pronouns, and organization, please. And we'll get started in a little bit. Alrighty, so we are going to go ahead and get started. Thank you all for joining us this afternoon. My name is Hani Mohammed. I am one of the program managers on the APDE team here at Public Health Seattle King County, and I'm joined here by my lovely colleague.
Hi, everyone. My name is Sarah J. I'm an epidemiologist in the health department. I'm on the communities count team, and I work quite a bit with Best Starts for Kids as well.
Thank you, Sarah J. So hopefully you all are in the right place. Again, this is the Racism as a Public Health Crisis, part 2 of our series. And today we'll be looking at data dashboards and COVID-19. And so just to give you all a quick overview, Communities Count is a resource that supports King County communities in the use of data to promote and achieve equity. Communities Count does this by providing data support and training to King County communities and highlighting data on disparities, inequities, and strengths in our communities. So we are sort of a private-public partnership with staff based in Public Health Seattle, King County. So next slide, please. And so we want to start off with some land acknowledgements. We gather today on the ancestral land of the first people of Seattle, the Duwamish people. We honor with gratitude the land itself and the Duwamish tribe and all Native people who call King County home. So this acknowledgement is really a small step against the erasure of our Native communities. In addition to the Duwamish, of course, King County is home to the traditional lands of the Muckleshoot, the Snoqualmie, and the Tulalip tribes and other Coast Salish people. Today's King County is home to a vibrant and diverse community of Indigenous people from all across North America and beyond. So to learn about how you can continue to support, or if you're interested in supporting our community of Indigenous people, you could either visit realrentduwamish.org or duwamishtribe.org to learn more. Next slide, please. To sort of continue on with the acknowledgements, this workshop is supported by the Communities of Opportunity, the learning community. So COO, as some of you might be familiar with. COO is a public-private community initiative funded by King County through Best Starts for Kids and the Seattle Foundation. And so they work through community-driven partnerships to create greater racial, economic, and health equity so that all youth and families of King County could really remain healthy and safe. And so to learn more about this partnership, please visit coopartnerships.org. So just to give you all a quick rundown of the agenda, we're going to start off with some meeting norms, and then we'll go into some goals, and then we'll review the role of data, which is sort of a summary of our first workshop in case you weren't able to attend it, because these workshops sort of build on top of each other. And then we'll look at some COVID-19 dashboards. We are joined by Tigran, who's a epidemiologist here at King County, and then also Dow with the White Center Community Development Association. We'll be asking some COVID data related questions. So sort of an interview, but we'll have our own set of questions to ask, and then we'll also invite you all to ask any questions if you have any. And so we definitely would love to hear from you all if you all do. If time allows, and that's why we have a little asterisk, we do have an activity planned for you all, but if we're not able to get to it because of questions or because of timing, we might just have to skip that, and then we'll go ahead and wrap up. So next slide. Before we get into the meeting norms, we do have some poll questions that we'll be asking at the beginning and the end of the workshop. So we'll start with our first poll. If we can show our first poll so we can have folks answer the first question. So the first question is, on a scale of 1 to 5, how are you feeling today? With 1, not well, and 5, great. We'll give us a couple more seconds for that. Seeing a lot of 3s, a lot of 4s. Seeing some 5s, that's good. Seeing some 2s too, and that's okay. Thank you everyone for participating in that. So I'll go into meeting norms real quick. So for meeting norms, kids, pets, and sweats are totally okay. Of course, and as a result of our polling question, we want to make sure that you're taking care of yourself. So please, if you need a break, if you want some snacks or drinks, feel free to go ahead and take the break as you need it. We would love to see your faces and welcome you to be on camera if you would like, but feel free to stay off camera if you're more comfortable that way. We'll be monitoring the chat box as well, and so please feel free to engage with us and let us know if you have any questions. And most importantly, please be sure to respect the experiences and the perspectives that others might share during this time. And so we will be recording this workshop in order to make it available for folks that were not able to attend today, and to make it available for you all, just in case you all might be interested in that recording. And so we'll be posting that recording on the Communities Count website in a week or two. And that's kind of why we do the recordings, is for you all to have access to this training material, and for folks who weren't able to attend the meeting or attend the workshop to have access as well. And so if you're just joining us, again, welcome to the Racism as a Public Health Issue Part 2 of our series. We're looking at data dashboards and COVID-19. And so feel free to introduce yourself if you haven't already, with name, pronouns, as well as organization that you are with today. Next slide, please. So learning goals and expectations. This is a little new for those of you that might be familiar with our workshops. After this workshop, we're hoping that you'll learn about the data collection process and how data is presented in COVID-19 dashboards, including limitations of existing data. You'll hear how communities have used and advocated for COVID-19 data to inform programs as well as outreach. And of course, you'll learn about how an equity tool, and this is again with the activity if we're able to get to it, how an equity tool is used to brainstorm and acknowledge how the framing and the perspective of various stakeholders impacts things like data collection, analyses, and of course, findings. And so this is a quick just expectation of our participants is that we really do value and honor the perspective and expertise and discussion of King County community-based organizations during this workshop. So while individuals from other agencies and institutions may be attending, it's expected that these individuals from these agencies are invited primarily to just learn and listen from the insights, questions, and discussion of our CBO partners. So it's really important for us to hear from our partners, and it's really important for agency folks to again, just sit, listen, and learn. And if there are any follow-up questions that you have, to direct them to either myself or Sarah J, and we'll be providing our contact information a little later in the presentation. So next slide, please. So just to give you all a quick overview of our first, this is sort of a summary of our first workshop. We see this conversation when we're talking about the role of data as a part of this sort of never-ending feedback process where data collection and dissemination changes as a result of community engagement. We just want to make sure that we're responsive to what folks have told us when it comes to data that we're sharing today or that we'll be talking about today. So we're referring to the population of King County as a whole, but we don't have one definition for every purpose or project. For example, with some projects, we connect directly with families and young people, and for others, we work primarily with community-led organizations. So sometimes you might be wondering, or you might be thinking about how these sort of racial categories came about. And so the Office Management of Budget, or otherwise known as OBM, definition of the 5 race and ethnicity categories are American Indian, Alaska Native, Asian, Native Hawaiian, Pacific Islander, Black, Hispanic, and white. And so we recognize and we understand that aggregated race and ethnicity categories are limited in capturing the reality of our diverse population. And we understand that this can result in invisibility and policy considerations, both all at the federal, state, and the local level. So we often have heard about the existing racial and ethnic categories don't necessarily correspond to the identities of groups. And so this is actually in policy. And we as community need to continue to push back against that so that, and we'll show sort of hopefully a breakdown of that in the dashboards. And so policies do impact data collection, and data impacts policies. And so we understand and we know that community engagement is essential for both, and that community engagement, translation, interpretation, and outreach are also very important parts of the data collection process. Community engagement is not done by the institution in charge of data collection and policy. This is, and this has really been a key driver of the data that has harmed communities historically. And now I'm gonna pass it over to my colleague, Sarah J, to give us a quick recap of the data cycle.
Thank you, honey. And if we could go to the next slide, that would be great. And as you all could tell, there's probably a lot we could dig into here. And if you're curious, I'm just putting a link in the chat to the page on Communities Count, where you can find a recording of the first part of this workshop series, if you're interested in digging a little bit more into this. But here, what we're looking at is some of you might have heard of before: the data cycle of data collection, data analysis, and data dissemination. And we see policies, things like translation and interpretation, programs that use and create data, and equity considerations have roles and impacts all throughout that cycle. And that can look many different ways. Some considerations that we think about for data equity include data sovereignty. So who owns the data and has the right to make decisions about the collection and application of a community's or an individual's data. Data justice through tools like culturally relevant surveys, translation, centering community voice from the get-go, and again, there's a lot we could dig into here, but I want to share just a couple examples of ways that, while certainly aspirational, our team in the assessment policy development and evaluation unit at the health department is trying to work towards greater data equity in the work that we do. So again, just a couple examples are making sure that when we have the opportunity to design our own data collection through tools like the Best Starts for Kids Health Survey, that we ask detailed race and ethnicity questions that are responsive to the input and requests that we've heard from community. So instead of just like Asian, Black, Native Hawaiian, Pacific Islander, we have much more detailed options like Samoan, Ethiopian, Cambodian. When we use data from other sources that has some more disaggregated categories, we share those out so communities can access them. We work to integrate qualitative data collection as one way to center community voice alongside some of the numbers that we have. A couple examples of where we've done that include the young adult and youth and young adult gun violence report and the LGBTQ spotlight report. And then we've also worked with partners across the state to add a question about experiences of racial discrimination to a statewide adult health survey called the Behavioral Risk Factor Surveillance System. Because even though, you know, having one question on one survey is certainly inadequate, there's really a lack of quantitative data that can show how prevalent those experiences of racial discrimination are for Washingtonians. So again, with that little recap, we're going to go ahead and move into today's focus on specifically looking at COVID data and racial equity. So next slide. There's a link here to the King County COVID data dashboards in case you are interested. If you take a look at the slides later, or you're certainly welcome to poke around, follow along. But for now, I'm going to go ahead and share my screen, and we're just going to take a look at some of this COVID data that King County has created and made available for everyone. So what I'm looking at right now, and please let me know, my co-hosts, if you can't see my screen. What I'm looking at now is our COVID data dashboard page. And if you're on any of the COVID pages on the King County website, you can get to this data dashboard hub by clicking along the left side, COVID-19 data dashboards. And you can see that there is just a lot here. And I'm going to go ahead and just guess that we have some folks joining us today who are like super users who have spent a ton of time and know all about navigating this data. I'm going to guess that we have some folks who took one look at this and had to turn off their computer for a second before they wanted to come back. And I'm going to guess there's some folks who might not have had a chance to explore some of this data before. And so those are all great starting points if you're joining us, and hope that each of you will learn a little bit more about where this data comes from and feel a little bit more confident using it. So again, there's a lot here. We've got the daily dashboard of key indicators that's updated daily throughout the week. We've got dashboards that focus on vaccination status as well as outcomes. This is pretty new, but I'm sure you've been reading in the news or hearing about breakthrough cases and how does that compare among our vaccinated folks and unvaccinated folks in King County. We've got more details on outbreaks. We've got the syndromic surveillance that shows data from hospitals about what they're experiencing in treating COVID. Social economic inequities, I think we may take a little bit of a look at that later today. And then more details on specific kinds of settings and communities, like folks that are currently unhoused, long-term care facilities, and our case investigation. So again, there's just a ton here, and we're going to start by just taking a close look at one. Again, going with our theme of racial equity, let's give a little overview of the race and ethnicity dashboard, which is updated weekly. If you click on any of those dashboards, you'll be able to view them in more detail. You may need to scroll down a bit. There's a lot of really helpful text that you'll see first here. I'm not going to read it to you now, but we'll actually be talking through some of it, and definitely recommend it if you have questions about what you're looking at. Reading this fine print, it might not look exciting, but it can be really helpful as you're figuring out some of the data. But let's go ahead and just take a look at that data now. Along all of the dashboards, you will see these little tabs along the top. They can be really easy to miss because they're kind of small, but those are one of the main ways to navigate the dashboards. And when I click here on distribution of cases, this is the first thing that I see. And before we look more closely at that chart and what it says, I want to point out that across this dashboard, you've got a couple options of different ways to view the data. So you can look at all cases. That's the default that we're looking at here. And if you want to narrow it down to cases excluding skilled nursing facility and assisted living facility residents, you can do that as well, because we know those have a little bit of a different context and different demographics than the cases overall. And then again, our default setting here is just cases, which means anybody that has received a diagnosis of COVID through a positive COVID test. But if you would like, you can also look at COVID deaths and hospitalizations as well. And you'll see these same options in the different tabs of this dashboard. All right, so taking a peek at the data, what are we looking at here? This shows the percent of cases in blue among folks of each racial and ethnic identity. And then in gray, their percent of the King County population as a whole. So looking here at this top bar, I see that white folks make up about 38.2% of our COVID cases in King County overall, but a higher percent, 57.7% of the King County population. So this shows to me that white folks are actually less likely to be impacted by COVID compared to some of the other groups. So for example, if I look at the Latinx community here, they make up 18.9% of the COVID cases that we've seen compared to 10.3% of the population. But of course, this is just only one way to look at how we see health inequities across COVID impacts here in King County. Another way that we can look at this is the rates. And using a rate can be really helpful because we're looking at a number that's been standardized. So for a small population or a big population, we think for each 100,000 folks that we have, which we may have a lot more, we may have fewer here in King County, but looking at that number, if we can imagine a group of 100,000, how many of them would have received a positive COVID diagnosis since the pandemic started? And again, you see the same options to choose deaths, hospitalizations, and look at just those folks outside of nursing and assisted living facilities. So when we look at the rates, this gray bar is the reference group, white folks. Overall, we've had a little over 4,104 COVID diagnoses per 100,000 white King County residents. And then for these orange bars, orange shows that we're looking at a much higher rate among Black, Latinx, Native Hawaiian, Pacific Islander, and American Indian, Alaska Native King County residents. And we do actually see a somewhat lower rate among Asian residents here. And then the last tab that we're going to look at together shows distribution over time. So both of the tabs that we've looked at so far, this distribution of cases, the rates of cases, we've seen some really big inequities. And one question we might ask, we've been in this a long time, it's been a year and a half. Have those inequities been changing at all over the course of that time? And so this chart is one way we can look at that question. Again, your same options to look at different kinds of data here. And what we see here is each line shows the percent of cases for a different race ethnicity group over time since March of 2020. So I'm looking, for example, here, this pinkish line represents percent of cases among Hispanic and Latinx residents, and it was really high, huge compared to their proportion of the King County population last summer. And since then, it's gone down a bit. So, that could be looked at potentially as at least a little bit of good news that while that inequity is way too huge, it's less than it was last summer. Whereas we see at the same time, the proportion of cases among white residents is going up. So there's a ton of data that we could get into here, but I'm gonna go ahead and we're gonna start with one of our interviews. Before I do that, are there any questions about the dashboards? We're gonna be talking a lot about the data that goes into them, but any questions anybody has while we actually have these dashboards up in front of us before we get into the interview, you can feel free to come off mute or put in the chat. All right, I'm not seeing questions, so if you do have them and throughout our interviews, we'll definitely be inviting you to come off mute again, and you can also just pop them right in the chat as you think of them as well. But with that overview, I am going to introduce my awesome colleague, Tigran Avungian. Tigran, we got a chance to briefly kind of work together last year when I was deployed on the COVID response, and I'm so happy to have you with us again today. Tigran is one of our team of epidemiologists that's been creating these dashboards, processing all of our COVID data for a year and a half now here at King County. And we're really glad to share his expertise about this data and what's gone into the creation of these dashboards. So let's start with kind of just a basic question. And again, Hani and I have a few questions for you, but we'd love to hear questions from the attendees as well. Just go ahead and drop them in the chat. Where does all this data that go into the dashboards, where does it come from?
Yeah. First, I just want to say thanks for having me. It's great to be here and present to all of you all and chat with you all. So we get our data from a variety of sources. The primary source that we get most of our case data is from lab reporting. So like tests for COVID-19 are mandatory reportable. COVID-19 is a mandatory reportable condition, which means that all laboratory reports done for COVID-19 need to be reported to the state of Washington. And that data is shared with us in King County for our jurisdiction. So we rely heavily on laboratory tests for both PCR tests and for antigen testing, and sometimes for antibody testing as well, to get accurate numbers of cases. We also link that data with data from hospitals and hospitalizations for COVID-19 to identify hospitalizations for COVID-19. And we also use death certificate data and data from the medical examiner's office to get data on deaths due to COVID-19 related illness. We also use data from our contact tracing team and Washington State's contact tracing team to get information on potential exposure settings, outbreaks, additional demographic data that we don't always get on our lab reporting. So that includes things like better race ethnicity data, preferred language, and then better address information because the addresses that we usually get from the labs aren't always accurate. So we try to use as many data sources as we can. With the COVID-19 vaccine being made available, We started using our immunization surveillance system, which Washington State uses to track immunizations, to identify people who have been vaccinated, and to make sure that our distribution efforts have been equitable and reaching kind of all communities in King County. And we've also been linking that data with our case data to kind of track breakthroughs and cases among people who have been vaccinated as well.
Wow, so I'm hearing that there's a lot of data coming in from a lot of different sources. We've got labs, we've got hospitals, we've got vaccinators, we've got interviewers from the contact tracing teams. You touched on this a little bit, but can you tell us a little bit more about how the race and ethnicity data is collected? And I know that's been challenging. So what are some of those challenges, and what are ways that King County has worked to try to address them?
Yeah, it's a great question. Currently, we are getting race ethnicity data from 6 different sources. So we get it from our lab reporting data, from case interviews. We get it from our testing sites directly, where there's a questionnaire that is provided to people getting a COVID test. And that includes kind of questions about race, ethnicity. And we have a partnership with a few testing sites where we get those data directly sent to us. We also use hospitalization data. To primarily like electronic medical record data to update race ethnicity data where we can. And then we use data from the Center for Medicare and Medicaid Services to use Medicaid data to update our race ethnicity data as well. So we have a pretty long process where we take kind of race ethnicity information from across these data sources and try to figure out which one is the best available and the most complete that we have. And we do this mainly because a lot of if we were to use just lab reporting data or just case interview data, we would miss about 30% of people's race ethnicity information, which is a pretty big number and makes it really difficult to like say anything about kind of equity or trends in COVID-19 by race ethnicity when such a huge number is missing. So we've tried to like complete as much of that information as we can. Using these other data sources. One of the struggles that we've had is that race ethnicity isn't always collected in a standardized way, or in a way that's kind of very specific to someone's racial identity. So a lot of the time, the data that we use is kind of very broad, and the data that's available is very broad, and kind of boils down to 7 categories, which are white, Black or African American, Asian, Native Hawaiian Pacific Islander, American Indian or Alaska Native, Hispanic or Latinx, and then other or multiracial. And in some cases, we can know what multiracial means. In a lot of cases, all we get is just like a line that says multiracial. And so there's a lot of challenges in getting drilling down into a specific community. And as you can tell, you know, some of these racial categories are very, very large, and don't encompass kind of the lived experience of all of the people that are kind of part of that group. So we try to distill it down as much as we can. We've been trying to use our case interview data and collect more specific racial and ethnic categories and affiliations with cultural communities in our case interview. But we can't interview everyone. And especially in our recent surge, we have noticed that our race ethnicity data is becoming more incomplete because we're relying more on lab reporting data and Medicare data and less so on case interview data. But we're trying to improve the quality as much as we can and do what we can with the sources that we have.
So you and your team, you know, you've taken all this data from so many sources. You've done your best to get the best race and ethnicity data that we can, even though it's still pretty far from what we might ideally want to see. When you think about like sharing the data in the dashboards and other ways that you share the data with our colleagues in King County, what are some of the equity related questions that people have asked or that we've tried to help provide more information about through the dashboards? And I know you recently worked really hard on the social and economic risk index dashboard. So maybe that's when this could be a good time to talk about that as well, if you would like to.
Yeah, a lot of the questions we get asked is, what are the specific communities that are kind of being the most affected by COVID-19? Where is transmission greatest? Where should we be targeting resources? And what are kind of the needs of the communities that are affected the most? The work that we have tried to do with the social and economic inequities dashboard, which I'll share in a second, is to try to look at kind of all of the driving, or make a more comprehensive view of kind of multiple factors that may place folks at greater risk of COVID-19, and try to understand how they're interrelated with each other, and how they're kind of like distributed geography, and how the pandemic has affected specific communities, not just by race, ethnicity, but also by kind of working class, by economic status, and also by kind of geography as well. And we really developed this as kind of a data resource that hopefully speaks to a lot of people's like lived experiences as well. Anecdotally, we've heard that, you know, all of these things are like intersect with each other. And it's not just race, ethnicity, it's not just like social status, it's not just economic status, it's all of these things kind of encompassed together. And we really wanted to like develop a dashboard that provides some data that speaks to that, and provides like a resource that people can go to say like, this is what I'm experiencing and this is the data that backs that up. And I can just show you really quickly where the dashboard is and what it looks like, if there's time for that. Yeah, so I think my screen froze.
Yeah, so far I'm just seeing a black screen. I don't know if anyone else is having that experience, but if it doesn't, if you want to try again, if it doesn't work, I can share it on my screen, and you can just kind of direct me to click around
Sure.
how you would like.
Can you see it now?
Yeah.
Okay, cool. So the dashboard that we developed is called the Social and Economic Inequities and COVID-19 Outcomes dashboard. If you go to our COVID-19 data dashboards page, it's the teal icon near the bottom of the page. The dashboard kind of is broken down by question, but the main focus of it is on a risk index that we developed to combine the social and economic risk factors that are listed on the right here, and contextualize that with how they relate to COVID-19 outcomes. The map on the front page kind of shows the distribution of census tracts by their social and economic risk index score. And it breaks it down into high, moderate, and low levels of social and economic risk. And then if you click on the buttons at the top, you can go to specific questions. So we can look at how the SERA relates to rates of COVID-19 testing and positivity. And what we can see is that the map for the social and economic risk index looks very similar to the map of where positive cases have been, which indicates that areas with high SERA scores have been placed at greater risk of COVID-19 and have kind of been affected the most by COVID-19 positive incidents. However, when we look at testing, we kind of see an inverse relationship where areas with lower social and economic risk scores have had a greater amount of testing than areas with higher SCRI scores. And this kind of indicates that to increase equity in our response, we need to increase testing, especially in areas with higher SCRI scores. And then we can kind of look at similar trends for hospitalizations and deaths. I won't kind of go into too much detail right now, but one other thing that I wanted to share is you can look at kind of specific factors and how they relate to COVID-19 outcomes. In this case, we're looking at COVID-19 positivity by each of these specific icons that go into our risk index. And what we see is that areas with a higher proportion of essential non-healthcare workers with greater levels of poverty, lower educational attainment, or people of color all tend to have a greater risk of COVID-19 positive cases than areas with lower levels of these factors. And I think this speaks a lot to how kind of intertwined the issue of structural racism and classism is, and how it's affected our COVID-19 outcomes in our accounting. And we've done a lot to address these factors in our response, but clearly this speaks to the need to do even more work than what we have so far. The last thing I'll share about the dashboard is that there's an Explore the Data page, which is my favorite part of this, because you can click around and change kind of the maps, the figures, the charts, and kind of make your own dashboard essentially. So it's kind of a tool that we wanted to create so that people can make their own screenshots, their own reports, and kind of like dig into the things that are important for them. So everything on this page is customizable. You can look at specific regions. You can look at specific factors that are built into the score. And then you can change kind of the measure to look at tests, positives, hospitalizations and deaths, and other factors. So it's kind of a playground for looking at the data in like a way that we haven't shared before. So yeah.
Awesome. Thank you for that tour of this new dashboard, Tigran. I know I've really enjoyed looking at it, but I've also kind of only begun to scratch the surface, and I'll be taking a closer look after this today. And I hope some of the folks joining us are interested to dig in a little bit more as well. And I'll ask you one more question before we open it up to questions from everyone else, which is how has, not just for this dashboard, but for all the other data products that your team has been putting out, what kind of feedback or questions have you gotten from community members, community partners, and how has their input been incorporated into these dashboards?
Yeah, a lot of our questions have been around, looking at trends in specific areas or in specific communities or among like specific regions of the county. And while we don't have the means to do all of the analysis that we can, it has led to us like trying to share even as much data as we possibly can in kind of a format that allows people to do their own analyses. So we've made available a lot of data sets for download that are broken down by demographic categories that are available at different geographic levels at the city, zip code, and health reporting area level, and also have provided daily and weekly summaries that people can download and use to do their own analyses. We are finishing up making available our downloadable data set on vaccinations so that people can look at trends in vaccine distribution over time and by geography, which we hope to release soon. And are trying to make as much of our data as transparent as possible. And in addition, we've tried to like update our dashboards when we can to kind of address the needs of the communities or answer specific questions that community members have. Our vaccine incidents or COVID incidents by vaccination status dashboard that we released last week was driven primarily by questions from community members and like a desire to see more information on what's happening with vaccine breakthroughs. So we're definitely open to feedback, and if there's things that you all want to see, we want to hear about it so that we know what to make next. So, yeah.
Well, thank you. And on that note, we would love to hear from you all. If you have a question for Tigran, please go ahead and come off mute, or you can drop it into the chat as well if that's easier for you.
I had a question, so I can sort of go ahead and start. And I think it's really important for us to sort of both humanize the experience of the individual who's like doing this work in the midst of a pandemic. So I'd love to just hear about sort of how you're doing and how you've been able to sort of manage the work that you're doing, because it's really important, but I could only imagine that it's also can be a bit exhausting. So how have you been able to sort of just manage it all?
Yeah, to be kind of extremely candid about it, you know, I'm also tired. I think I kind of think everyone is, but you know, we kind of struggle alone in our suffering, right? So just to put a voice to it, yeah, there's a lot of burnout, and it's difficult to see the numbers go up and to like you know, be in the midst of a fourth wave. A lot of the time, our team is the first ones who sees the daily increases. And so, you know, like to kind of like absorb the main shock of that like immediately is always like kind of hard. You know, one thing we've tried to do is like keep in mind that we're trying to make tools to, you know, communicate what's going on with the public, and, you know, make a resource that people can use to make decisions, both for their own risk and also for their communities. And, you know, if we can kind of alleviate people's concerns or give them a better idea and understanding of what's going on, you know, that's kind of the peace of mind that I need to kind of keep going with my day. So yeah, I think that's what keeps me motivated, and as tired as I am, you know, to keep going. So yeah. And I appreciate you checking in.
Yeah, no, thank you for that. And it's interesting how your response is sort of still like community centered and community focused. Like I'd ask you how you're doing, and you're like, well, I'm not doing good, but I do find sort of comfort in making things a little easier for other people, right? And so making this information, which can be extremely overwhelming, just digestible for our community and the people and the people around us is admirable. And so thank you for that. We really do appreciate it. Do we have any other sort of questions or follow-up from folks here? We'll give it maybe a couple more seconds, and if not, we'll go ahead and just wrap up our interview with Tigran.
I have a question for Tigran.
Oh, I think that was Teresa. Teresa, I think you muted yourself.
I'm still playing with technology.
No worries. Go ahead.
Tigran, I was wondering, when you mentioned that that we're kind of going through a fourth wave, if you could just elaborate on that a little bit more, like what do you see as far as trending in communities of color, or, you know, just your insight on that?
Yeah. So if you look at our trends kind of over time, you know, we've had kind of increases and decreases in our case counts over time. And this is really kind of the fourth kind of big increase that we've seen in King County and in the country as a whole, where we've seen like a big increase in cases, hospitalizations, and deaths kind of all happen right now. And, you know, a lot of this wave has been because of the Delta variant and kind of the changing nature of COVID, kind of relaxing kind of the restrictions that we had, and, you know, loosening some of the mask mandates and things like that definitely contributed. And we're hoping we can kind of get to the other side of it as more people kind of, you know, start getting vaccinated, and we see kind of increasing restrictions with masks and things like that come into play. So that's what we've been seeing in the data, is kind of the number of daily cases is currently around 550 cases per day in King County. At our lowest point in July, it was at about 67. So it's a pretty big increase from 67 to 550. And we're hoping we're kind of at a plateau right now over the last couple of weeks, and we're hoping this kind of continues and we see a decrease soon. Time will tell.
Then one last question, because you mentioned the Delta variant as well. And I was looking at the news and there was something called the new variant. Is that being tracked in King County, or has there been any cases in King County that you know of?
Yeah. I'll share it here. We're trying to put out a more detailed report on variants, which will come out hopefully soon. These things take a lot of time to get reviewed, so fingers crossed. But yeah, we have been tracking there's been 2 new variants that have been kind of in the news recently. One is Lambda, and then one is Mu, M-U, M like Mary. And we haven't seen any Lambda cases in the county in the last kind of 3 months, which is pretty good. We don't know if that's going to change, or like kind of, if we'll see things emerging. And then Mu cases, we've seen about 40 overall, with about 23 of them coming in the last 2 months. So there's been a slight uptick in the Mu variant. But what we have seen the most of is the Delta variant. We don't sequence every single case that comes in. We don't know what variant they have. We have data on about 20% of our cases with regards to what variant they are. And about 99% of those are the Delta variant. So that's kind of been our main focus. That's not to say that other variants aren't circulating in our county. And I think we can kind of assume that they're here. But, it still continues to be kind of a majority of the Delta variant.
Thank you.
Yeah.
Any other questions? All righty. Well, thank you so much, Tigran, for taking the time this afternoon and answering our questions and being a great resource to not only us, but to those that are participating as well. So we really appreciate that, and thank you so much.
Yeah, thanks for having me. If there's any questions over email, you can feel free to reach out to me. I'll pass my information to Sarah J. and Hani.
Awesome.
Thank you all.
Thank you. Great. So we're gonna move on to our interview with Dao. And so I'm gonna let Dao introduce themselves. And so Dao, please feel free to give us a quick introduction, who you are, and sort of your role. And yeah, we'll go from there.
Hi, everyone. Thanks for being here today, and thanks for inviting me to be here as well. My name is Dao Chan, and I work at the White Center Community Development Association as a data and evaluation manager. I know that in the last year, there have been so many organizations that have been working so tremendously hard in response to COVID and response to our community. Especially organizations that are working with BIPOC communities. So I'm always really amazed at all the work that folks are doing, including Communities Count, and as I'm listening to y'all and the work that you're doing. So I just want to say thank you. I recognize the work that everyone is doing, and to support each other and to support our communities. And I feel really honored to be here and very humbled to be here to share my experience with you. A little bit introduction. I'm not sure if people are familiar with White Center. So I just want to give a little bit introduction of our community and the work that we do. White Center is a very diverse community, is unincorporated. It lies right underneath West Seattle and north of Burien. So we're an urban community of about 15,000 residents, and about 2/3 of those residents are people of color who mostly are immigrants and refugees from different Spanish-speaking countries, from Vietnam, from Cambodia, Somali, East African countries. So we're a very diverse community, and on top of that, we're also unincorporated, which is interesting because we're so close to incorporated area. So we our direct partner government in government is King County, since we don't have a city. And White Center Community Development Association, we were formed about 19 years ago. So next year is our 20th anniversary, and my boss, our executive director, Celie Savusa, maybe some of you have heard of her. We are very excited about celebrating our 20th anniversary next year, but we were formed by our BIPOC community leaders who came together because they wanted a better future for our families and our children. And to this day, the CDA continues to stay true to that commitment. We're continuing to develop authentic relationships with our community, with other nonprofits, with our leaders, and continuing to build leaderships in our community. So that means we work a lot. We do a lot of different things for a small organization of 15. We kind of have our hands in everything. We work in schools. We have partnership with schools and teachers. We work with businesses, small businesses, BIPOC businesses. We work with other other unincorporated communities like Skyway and Vashon. And we work with government agencies like King County and King County Local Services and other nonprofits. We have diverse partnerships in our community. And yeah, I've been at the CDA for about 3 years now, and I always struggle when people ask me what I actually do, because even though my title is data and evaluation manager, we're a team of 15. So I kind of do a little bit of everything and support our staff in different projects in different ways that I can. So yeah, I always have a hard time kind of struggle with answering that question, especially when it's asked by people in my Vietnamese community. I always like kind of stammer, and at the end of the day, I always say, well, I work with community, and that's kind of exactly that kind of sums up everything that I do. So it's I realize I've been there at the CDA for 3 years, and for half of the time, 1.5 years of it has been through COVID. So a lot of my work has been around COVID, unfortunately. And I feel like through the 1.5 years, I've really learned a lot. So I'm happy to be here to talk about my experience. Sorry for the long introduction.
No, that was amazing. Thank you so much. First and foremost, well, congrats on almost 20 years. That's really, really exciting. I know that both in my previous role and in my current role, I've heard a lot about the White Center Community Development Association. So you all are doing some really amazing work, and just thank you for that. I think that it's interesting you say that sometimes you don't know like how to explain your role, because I think when it comes to sort of data roles, you could be on an evaluation team, you could be analyzing the data. Like there's so many different components when it comes to so many different things that all encompass data and data evaluation. So, and I see Corey in the chat box also shares those same feelings. And so thank you for sharing that. So the first question is sort of what COVID-related data resources have you found useful?
Yeah, just in regards to what you just said, my team continues to think that I am a tech person, even though I'm not. I always question, why is tech and data? Why does it have to? But yeah, so that's really interesting, that, you know, we kind of have a foot in our hands and everything, and we try to just support our community through with things that I personally don't feel you know, that I'm adequate on, such as tech. But in the work that we do around COVID has relied a lot on database management and a lot on technology as well, especially now that we have to work you know, virtually, and we still are working virtually as we are responding to our community. So so then, yeah, there has been a lot of tech support for our staff as well in what we do. But back to your question, yeah, we have definitely relied on COVID related data to better understand our community and our community needs. So right when it hit our community in March, right when it hit and we started working at home virtually, we started calling our families and asking our families, what is your experience? What are you going through? What do you need? How are you? The first question that we asked was, how are you? How are you feeling? How's your family? To really understand, we have the data that's going on in our community in King County, in the state, but then we also needed to understand better what our community is experiencing and what they're going through. So based on just really talking to our community, we have staff who speak different languages and are connected to different communities, and so we rely on our staff to be able to gather that information and bring it back and come up with a solution. And so even though our organization's never really done financial support before, that was one of the first steps that we took, because the data was telling us, the data the community was telling us, that that's what they needed. They needed resources. They needed help with financial support. And so by early April, we using the technology and the data skills that I have, we started a community funding process that we've never done before. And we relied on our community to tell us what is it that they need. And we supported them with rent, with utilities, with money for things that they need, childcare, anything like that. So so that was one of the first response to our community based on the data that we were able to gather. But you know, continually we rely on data to understand our community needs around vaccination, for example, where resources are, how can resources be distributed or redistributed to communities that are in needs. And so, you know, we're continuing to rely on data, but also continuing to ask our community what their needs are around everything around COVID, really. And, you know, when I was talking about the CDA and everything that we do, the thing that I'm always so proud of the CDA is that we are so nimble, because we're able to respond to the community needs in that way. We're connected to our community, and we in that way we can understand our community needs more and be able to respond more quickly. And so we leverage our fundings, and we leverage our connections, and we leverage our relationships to be able to respond to our community.
Thank you so much for that. And so what I'm hearing is sort of at the greater level, you sort of had King County data and both sort of state and federal data available to sort of let you know what's going on in terms of trends, and let you know where are the gaps and what are the impacts. And then what you really used was sort of the resources was the community itself, you know, and having folks that are in your organization who speak the languages, who understand, who have that trust built already, to go into community and to have those conversations and to do some reallocation of funding, because it's hard for people to think about. I think sort of COVID I think trends and when baseline necessities aren't being met, right? When things that people need to survive, like rent, like to pay their utilities, like food, aren't being addressed. And so thank you for that. And so my follow-up question to that is why do you think having COVID related data by race and ethnicity is important for your community as well as your organization?
Yeah, especially for our organization and our community, data by race and ethnicity is so important because our community is highly impacted. And as we already, I mean, I think all of us already know that there's our systems are racist and our systems continue to negatively impact community of color. And so as a community that is that has been affected historically, has been marginalized historically, we know that a crisis like this pandemic can only heighten the issues, the barriers, and the challenges for our community. So yeah, it's definitely important for us to ask that questions and to see how is COVID affecting our community by race and ethnicity. Both you and Tigran mentioned, I think the limitations with the data on race and ethnicity, and I completely understand because even for myself, when I ask our community, when we do surveys or ask communities, and we ask that question, I always kind of, it's a challenge for me because I hate having to categorize people and to box people in 9 or 7 categories. And it's a huge struggle. And we try to use other type of data such as languages and other things like that. But I also understand and recognize the importance of having data so that we can understand the struggles of each of our communities. So we need that breakdown. As long as racism still exists, we still need to ask those questions. So yeah.
Thank you. And indeed, ethnicity and even and like you said, ethnicity sometimes might not even be enough. We might need to even go into language because even within the category of Black or African American, you have Black Americans, you have Black Caribbeans, you have Black continental Africans, and so it's even more challenging when the data that you're getting doesn't necessarily tell the full story. You get a piece of the story, but you don't get to see the full story, and so. That's why I think we should really start moving towards language, right? And looking at language data, because I think it's a much better place for us to start than these really than these 5 big categories that don't really give us the full story. So how have you, and I think you touched on this already, but how have you advocated for COVID data that is responsive to your needs or your organization or community needs?
So last year, when I was doing the end of year reporting for COO and for other reports, and I was sitting down with our executive director and other leaders in our community and just kind of going through like the different committees that people are sitting on. I'm just like, wow, we are just sitting on at every single committee. We're sitting on health committees, we're sitting on school committees, because we're there because we're trying to elevate the voices of our community. And that's the way that, we're fortunate to be able to be there, but we're also advocating for more community to be in these spaces. So yeah, we've advocated for everything, and in between everything we've done, we advocated for more data around schools, how are our kids doing, how are our parents doing, and just around access to resources, where are the food resources at, what kind of food resources are out there, just in ways, how are our communities been accessing vaccinations? What are the barriers to vaccinations for our community? Testing, for example, what are the barriers for our community testing, childcare? So all of those, we've been in all of those spaces, and we've tried to be in those spaces to not only speak our voices, but also bring more community to the table so that they can share their voices as well. But yeah.
You talked about sort of vaccine and vaccine rates. And so what have you experienced, or are you hearing any sort of hesitancy or concerns? Are you hearing anything like that in community? And if so, would you mind sharing what some of those maybe concerns are, or maybe how you've even been able to address them if there are those concerns?
Yeah, so in the beginning, so I'm actually outside of my work for the last year and a half. I've been kind of deeply involved in the Vietnamese mutual aid work. And so I can speak for the Vietnamese community pretty well, I think, in terms of vaccination. So there were some hesitancy around vaccination. A lot of our elders, our Vietnamese elders in our community are more, was at that time pro-Trump, and, was kind of listening to those stories and having this distrust for the vaccine. And so for sure in the Vietnamese community in the beginning, that was heavily the case. And so we could just, I think for me and the work that we were doing, we were just listening to our community, and we weren't necessarily, trying to push aside their stories. We just really try to listen and try to understand where they're going, what their experience and what they were thinking. And so over time, I think as more Vietnamese people were getting vaccinated, that kind of died down. And so, and I kept calling our Vietnamese elders and asking them, have you been vaccinated? And asking them if they are hesitant, what the reasons are and stuff like that. And so we found that it eventually kind of died down, and that for communities who do want to get vaccinated, but were having trouble accessing for language or other reasons, we were trying to be supportive in that kind of way. We were trying to get them connected to rides. We're trying to get them connected to communities who could stand in line with them, who could register for them. So that's how we were responding. There's definitely still hesitancy in our other communities as well. For example, our Somali communities, I do hear a lot of hesitancy around that. And it's kind of slowly, I think it moves in wave back and forth. And I think one of the things that I really, right now, currently, just like what Tigran was talking about in terms of data around vaccination, is from our organization, our community, we are also trying to understand that more, right? We understand there are hesitancy around our different communities and different groups, but we're just, I think we need to dig a little bit deeper and trying to understand exactly how they're feeling and being there for them and listening, listen to their concerns. But yeah, so I don't know if that really answered your questions. It's a really,
it does.
Yeah.
It does. Thank you.
I think it's an issue that we all kind of know about, but we haven't really dug deep and really listen to our community to understand exactly how we can be there to support them. And I hope that's something I hope that we as an org can continue to do with our community.
And yeah, thank you for sharing that. And I think that's a good point, that there is indeed hesitancy, and that hesitancy is okay, because there's trauma, right? There's historical trauma in the reasoning why folks feel this way and why why communities are hesitant. And I think
Yeah.
it's important for us to not try to invalidate those concerns and those
Yeah.
experiences, because if we invalidate them, then we're sort of pushing community further away, I think,
Exactly.
from getting the information that's necessary. It's scary, and it's interesting that you say that you mentioned the Somali community, because that's who I work with sort of outside of my role at King County, because there are concerns, but there is a slew of misinformation that's out there. There's so much misinformation that's out there because the people who have this agenda have that agenda for a reason, and there's a reason why misinformation is being pushed into our communities. And so I think it's our job to present the resources and the information that we have, that we're aware of, that's backed by science, because a lot of the misinformation is not backed by science, and it's a lot of people who haven't studied it, right? And who are making these assumptions. And so it's really important for those of us that are privileged enough, who have access to these resources, who have access to this information, to share that information. But you want to empower community to make those decisions on their own. It shouldn't be coercion. It shouldn't be, this is why you have to. It should be, hey, this is the information that I used. I try to always create sort of anecdotes and share personal stories. And like, I had family members that were also hesitant, and I shared a couple of resources. There was no persuasive messaging or language in the messaging that I was sharing. Here's the information that I have. You feel free to make the best decision that you can for your health and your family. And so that's really important. And so thank you for sharing that. We've got 10 minutes left, so we got time for one more question, and then we'll go ahead and wrap up. How have you used sort of COVID data and supplemented it with your own community resources? And if you have any examples of those, we'd love for you to share them if you'd like.
Yeah, I think part of this questions, I think I've already touched upon. I did want to bring back what you said about community trauma and our experience a little bit, because, like, for example, in the Vietnamese community, our trauma was going through the Vietnam War and communism and coming over here. And so our trust for the government, our trust for the community is very different than other communities. So yeah, like you said, is about a lot about misinformation and about sharing information. And really it's about, the power of community connection and the power of community leaders and community and people we trust in the community, right? So for example, in the Vietnamese, in the Viet Mutual Aid, we originally had a form online for Vietnamese mutual aid, but no one was really using it. There was only a few people, even though we translated it into the Vietnamese language. But that's still not accessible. That doesn't mean it's accessible. Just because we have a form that's translated, just because we have a material that's translated, and then we can't stop there, right? And so in the beginning, it was very, people weren't accessing it. But eventually, when I was making calls to families and my phone number got out. And so it just like spread like wildfires. I started with like having connection to like 10 Vietnamese families to having connection to 500 Vietnamese families in a couple of months. So that's just going back to the power of our community and how connected we already are, and how we rely on people that we trust, and how do we build that trust? How do we build that trust for our community to trust us, but also for us to trust that our community knows the best solution? So that's really how we use COVID data, and then also supplemented it with our own resources. And because we are able to connect to our community in that kind of way, and try to understand our community and support our community through the trust that we've built over the years.
And so I'm gonna, I lied, one more question. Well, not really a question, but more so a check-in, very similar to the question that I had asked Tigran, sort of how are you doing in all of this, and where are areas maybe that you're finding just joy and maybe comfort in these sort of difficult times?
Yeah, thank you, Han, for asking for asking that question. Yeah, we like Tigran, we're all overworked, but you know what? We're tired and exhausted, but our community is also tired and exhausted as well. And so I think knowing that we are here for each other through the tough times and the happy times too, because we have weddings and we have birthdays to celebrate and we have the good things too, is I think what keeps me going. And I think our community definitely, it's important for our community to be able to continue to celebrate and continue to be together in different ways and support each other.
Awesome. Awesome. Thank you so much, Dao, for joining us this afternoon. It's been really a pleasure to have you and to share, for you to share some of your experiences and your knowledge with us. If you have any, we won't sort of get into them now because I want us to get into our sort of our wrap up. But if you have any resources or tools or anything that you would like for us to share with participants, and I think we'll have Tigran do the same as well. Any sort of resources or tools that you think might be helpful for those that are attending today, please feel free to email myself or Sarah J, and we'll include that in our sort of resources when we're sending out material. So thank you so much. We really, really appreciate it. And I hope that you just continue to take care of yourself first and foremost. But again, thank you for the work that you and your organization are doing for your community. It's definitely very important. So appreciate it.
Thank you.
Thank you. If I can have Megan share the screen again so that we can get to our couple in the last sort of minutes that we have left. We'll do our wrap up, and then we have a couple of polling questions that we'd like to wrap up with. So we'll just go to the feedback slide. And then we'll administer the poll first. We got a couple of polling questions for you all, and if you don't mind just taking a few moments to answer those for us, we'd really appreciate it. Feel free to answer truthfully. Don't worry about us sort of being here and watching you answer the questions. So we can go ahead and wait a little bit, a couple more seconds. Okay, we'll go to the next question. We'll go to the next one. And then our last one.
And it looks like we have one more after this, Hani.
Okay. Thank you. Okay, now we'll do our last one. Alrighty, so we'll end the polling. And then we'll go to the last slide. So Sarah J just dropped in the chat box what we couldn't cover in the polling, which are just a couple of open-ended questions. We do realize and recognize that we weren't able to get to the hands-on activity, but that was in order to just give more time for the interview process. And so we apologize in advance for that. But thank you so much for joining us this afternoon. We really, really appreciate it. Again, this is part 2 of our racism as a public health issue. We looked at data dashboards and the impacts of COVID-19 this afternoon. And so we will be providing this workshop again in a couple of weeks, I believe on the 23rd. And then a little later in fall, we'll have our final series of the workshop, which will be a community storytelling is what we're planning on having for that workshop. So please be on the lookout for invites around there. Feel free to reach out to myself or Sarah J. We have the whole team on here, but myself and Sarah J are who facilitated the workshop today. If you have any feedback, any questions, any concerns you would love to share with us, we would love to hear from you all. And yeah, I hope yes, please don't be shy. We'd love to hear from you, as Sarah J mentioned, but I hope you all have a good rest of your afternoon. Be well, take care of yourself. It's really nice out here in the South End. And so I hope you all can maybe go outside and get some fresh air and see some sunlight, and make sure you stay hydrated. So thank you again. We appreciate you all, and we hope to see you all again soon.
Thanks, everybody. Have a wonderful rest of your afternoon.
Bye, everyone.
Thank you.